afternoon and welcome to the March 2024 Pitt County Board of Social Services meeting. I would like to start by calling the meeting to order and observe a moment of silence. Thank you. Do you have any public comments, public address?
Yes, I'm sorry. Do you want me to?
I got it. I got it. All right. Mr. Holder.
Yes, hi, good afternoon, how are y'all? So, I was here 60 days ago. Asked y'all to reach out to me. No one bothered to reach out to me.
Mr. Holder, can you hold on 1 second?
Yes, I'm so
We
sorry.
just need to read the statement on there.
Okay, yeah, I'm sorry. The Pitt County Board of Social Services welcome all comments on matters of public concern. Each person will be allowed up to 5 minutes to speak. Actually, 3 to 5 minutes to speak. All citizens are expected to follow proper decorum and shall not use profanity or defamatory speech. Thank you.
Okay, good afternoon, how are y'all doing today? So, I was here 60 days ago. I had to subpoena everybody, go to court, and get a judgment to get all the records of being accused of abusing and battering my children. So, from Teddy Bear on November 17th, 2023, as you are aware, Leona and Hunter were evaluated on 11/16 for concerns of physical abuse by their father. Instead, we saw clear indication of severe emotional abuse by their mother and severe form of parent alienation. To summarize, the fact Leona was the aggressor in the altercation with her father that took place in his car in the mother's driveway. Leona had been to volleyball practice and the father was picking her up. Brother Hunter, I presume that it was to be the father parenting time. The video that the mother took shows Leona attacking her father and screaming at him, and he was restraining her by holding her hands down on the center console of the front seat. The mother made no effort to intervene, but Weather was filming the event on her phone. When the father let go of his restraint of Leona's hands, she attacked him. The mother reached in the window and grabbed the father's right arm. During all of this, Hunter got in the back seat and was ready to go. The father called law enforcement and remained nearby. 4 police officers reviewed the video and concluded that Leona was the aggressor. The mother was charged with assault on the father. During Leona's interview at Teddy Bear, she was seen to be texting someone on her phone during her break. The mother had just been texting someone before the break. Our finding that Teddy Bear follows this evaluation is that both children have suffered emotional abuse by the mother's attempt to cause alienation from their father. Hunter has some intellectual limitations and could be easily confused by the mother and older sister. His report of being choked since he was 1 year old by the father are not credible. He expressed some thoughts of harming his father. We will still be staffing this case on 11/22, but you asked for a written report in advance of that meeting. Currently, our recommendations are for Leona. And it says here, no unsupervised contact with the mother. So, you guys investigated me for abusing my children. You guys never contacted the sheriffs. Well, you said you contacted the sheriff. The sheriffs told you guys I never laid a hand on my children. Teddy Bear told you guys I never laid a hand on my children. That the mother made this all up. That the mother is mentally abusing my children. As soon as you guys found out that I never did nothing and that the mother did this, what did you guys do? You guys closed this case out. You guys are not helping my children. I'm fighting in court to get my children away from the mother. When you guys found out that the father does everything for my children, no apologies, no reaching out to me. You closed this case. You have a caseworker that lied, said he never called the police, to have 10 to 15 police. You guys investigated yourself, found no wrongdoing. I'm still investigating. You guys have done so much damage that is pathetic. You guys have not once reached out to me, said, how can we help you? I came into you before this all started. I was told nothing's going to be done unless you harm your children. I told you guys about this before the mother called you guys. You guys blew me off. Something is going to be done about this, or I personally am going to bring a civil suit that will rock this city and jeopardize your job and everyone else's job. This is a guarantee. You closed this case because I did nothing wrong. But you guys have the records showing that my children are being abused by their mother and that they should not have unsupervised visits with their mother. And you guys closed it. And the case manager said he took all the blame off of him and he blamed it on you guys. He blames it on you guys, but yet he still has a job. And I have all the video that shows that he lies. And he still has a job here. So now I have people at Channel 9 and other news stations that are waiting for me to release all the videos and all the evidence to them. But I'm patiently waiting for you all to reach out to me, like I told you 60 days ago. And you all have not. You're blowing me off. My patience are wearing very thin. You all accused me of abusing my children. All the proof which you guys have shows that I have not. I'm a very caring father that loves his children, does everything for his children. You all are going to make this right. You have the proof on who's abusing and filed a false report. You're going to make it right, or it's going to come out to everybody that you guys are not. I'm letting you know right now.
Okay.
You need to make this right.
All right. Thank you, Mr. Holder. The board take that under advisement. Next, we have Ms. Hopkins and Ms. Shavonda Ormond.
Good afternoon. My name is Alva Jones Hopkins, and this is Shavonda Perkins Orman. We are here to speak on behalf of the annex location and to express security concerns in regards to that. Currently, upon entering the building, there is direct access to staff when you enter that building. There are no security barriers in place once you are inside of the building. The building is currently not equipped with announcement alerts, security equipment, so that the staff can be notified once there is a imminent danger or if there is a situation that regards a lockdown. Also, we would like to state that one suggestion would be to implement a cell phone or a email alert system where we can make direct contact with staff immediately. The building currently has no deputy or security personnel that periodically monitors the location. And then also there is no known safety assessments that are conducted at the annex location. Implementation of some of these would provide better protection for the staff that are working in that location. Shavonda is going to give some statistics in regards to the traffic in that location as well as in regards to the occupancy.
Thank you.
So just to add on to what Alva was saying. Pull the microphone down. We have
So,
a turbine back there.
can you hear me?
Now you're doing better.
Okay, great. So just to add on to what Alva was saying, to just give some numbers, last year from January to December in the annex building, we had about 2,700 people to come in to sign in just to our building, the annex. And just for January and February, we've had about 430 people to come in to sign in, and we have we have 16 people that work in our building, in the annex building. So we do have some people, a whole lot of people that come in our building, even though it's small. Thank you all for your time.
No, thank you. We'll take that up with the Bosman. Thank you. Mr. Brinkley?
Hello, I'm Gary Brinkley. I'm a Child Support Agent 2. I'm located in the Human Services Center. And I'm also here to talk about safety in our building. Most recently, we had a gentleman run into our building stating somebody was going to shoot him.
What building is that?
Human Services Center, which you can imagine caused panic amongst staff. And like the previous lady stated, we don't have an effective communication system in our building. We don't have law enforcement. We've been prohibited by the county commissioners from concealed carry in the building. And as you know, if somebody's intended to do harm, they will not pay that sign any attention. So that kind of leaves us at the mercy of who's there to do us harm. To give you a better understanding of some of the things we do, we approve food stamps, Medicaid in that building, but also child support. We deal with people that are not happy with us. We seize people's bank accounts, which means their account is frozen. They don't have access to it until they file a motion and go to court. We take people's tax money, which is another reason they could be very upset. So, you know, there's a couple of recommendations that I have because, like the previous said, they have access to the building, free access to the building. There are secure areas, but, you know, they're not really secure. We need cameras, exterior and interior cameras, which serve as a deterrent, but it also records anything that may go on, so we'll have a record of it later. Personally, I would suggest that we go to the county commissioners and ask them to back up on the policy against concealed carry. We had it implemented for 5 years, no incidents. A lot of staff went out and got their permits for that purpose because we have a right to protect ourselves at work. It's in the Castle Doctrine, state of North Carolina. I also believe there's systems can be set up, particular codes that could be announced. It would make staff aware of what the particular situation is, what they need to do. Staff could be trained on that. It'd be very specific. Right now, the announcement was made the other day, go in your office and lock yourself in. Well, that breeds curiosity. People want to know what's going on. With that system, they would know what's going on, they know the level of the threat, and exactly what they need to do. Another thing is, you can't rely on email, telephone calls, they're not reliable. A system like the ladies before me mentioned would be great, but I also think the management team should have walkie-talkies so they would have free communication with each other to find out what's going on in a particular part of the building. And then information travels faster. So currently our policy doesn't allow for any of those things to happen. And I would like to see an update to the policy, some concern for the safety of the employees in that building, as well as the public. Thank you.
No, thank you, Mr. Brinkley. We'll take that up for advisement. Next, we'll have Miss Kaylee Doonan.
You can skip over me, I did not mean to put my name on there. You're good, keep moving.
You sure?
I'm positive,
Okay,
1000%.
all right, thank you.
We do have one more write-in. Teresa Sampson, who is the intake program manager for the Human Services Center, was unable to attend but asked for me to read this to the board and put it with the minutes. So she stated, "My plan was to come today and present some talking points to the board about safety. Number one, in 1991, murder of four child support workers in Watkins Glen. A gunman walked in and shot all of them because he didn't want to pay child support. Number two, glass entry doors that don't lock, and many times we don't have to use the badge to get in." She said, number three, the glass at the front is not bulletproof. Detox wanders into a part of the building, so they share part of that building with the detox. Inmates, when released, come over and hang out at that building. The parking lot is dark, especially in the back part. Oops. The back part by the wood line and the street parking. Woods where people can hang out and you can find them. Response times when calling for assistance. And lastly, she stated, temperature of America in regarding violence. People walk around with guns strapped to their sides, etc. Even in Walmart, tend to use violence to solve their complaints. And that's all I have.
All right. Thank her for that feedback from the board. All right, next we'll have the approval of the agenda. You all should have received last month's agenda. Are there any revisions?
I make a motion to approve the agenda.
Have a second?
I second.
All in favor?
Aye.
All opposed? Any discussion? Thank you. And now we have approval of minutes.
Move to approve.
I will second.
All in favor?
Aye.
All opposed? Any discussions? Thank you. At this time, I'm going to have recognitions of new hires.
Good afternoon, everyone. As I call your name, if you'd please step forward, come up to the podium, make sure that you're talking into the microphone, and introduce yourself. Just say a little bit about yourself and what you're doing now for Pitt County Department of Social Services. So our first person we have is Zoycia Gray, and if I mispronounce your name, I'll apologize ahead. Welcome, and you can correct me.
It's Zosha Gray.
Zosha, okay.
Yes. And yeah, I'm Zosha Gray. I am contracted through DSS, but I work at ECU Finance Services as the processing assistant.
Well, welcome.
Thank you.
Thank you.
Thank you. Welcome aboard.
Carlisa Williams.
Hello, I'm Carlisa Williams. I have over 17 years experience in mental health and IDD, so I
Thank
come
you.
from facilities where I used to send stuff for you to sign, so I have history with Pitt County, Northampton County, with guardianship, group homes facilities. So now I'm transitioning to CPS, of course, fourth floor investigations.
Welcome,
Thank you.
Carlisa.
Welcome aboard.
3N Herbert.
Good afternoon. My name is 3N Herbert. Most of my CPS experience has come from Virginia. And now I am here on the fourth floor CPS assessments as a supervisor.
Welcome.
Welcome aboard.
Amber Williams.
Hi, my name is Amber Williams. I am a new employee here at Pitt County. I will be an income maintenance worker at Social Services.
Thank you.
Welcome.
Welcome aboard.
Andrea Bannerman?
Hello, my name is Andrea Bannerman. I graduated last May from ECU. I did a little bit from Lenore County. Now I'm transferring over here to Pitt, and hopefully this will be my forever home.
Great. Welcome aboard.
Thank you.
I hope it will too.
April Daniels? Okay, I think April will not be joining us this afternoon. Well, welcome anyway, April, if you happen to see this televised.
Next, we're going to have an Excellence Award presentation.
Do you think?
No. I thought you were talking about this email.
Oh, that's right, don't worry about it.
So we have Alicia Spicer to step forward.
That's a first, isn't it? Clap.
And Candace, would you mind stepping up as well? I got you. Oh, doesn't it? We're recognizing Alicia this afternoon with a certificate of excellence in her continuing efforts in the Adult Protective Services Division. And Candace is our program manager. Candace, could you talk a little bit about Alicia's above and beyond that she's done for adults protective services?
So Alicia always goes above and beyond. So we received a letter from a client that just kind of talks about how even after their case was closed, they were still able to contact Alicia, and she was a resource for them and trying to help them through navigating some new waters for them and making sure that their needs were met even after our case was closed. Alicia has been out for some time, but she came back on February 22nd and just jumped right back in because she's an asset to our team, to our division. She supports our APS workers and helping them and making sure that things get done. When it's quiet and there's a lull in her day, she doesn't just sit there. She is calling and saying, hey, what can I do for you? Can I help you? Can I help? Even outside of her own unit, because she is an employee in the APS unit, but she will reach out for guardianship or as a in-home, hey, can I make phone calls for you? So she's just always seeking opportunities to be able to help her team and to help others. And the letter that we received just kind of gives voice to that.
So congratulations. Thank you for all you do for Pitt County.
Thank you. Let's give Ms. Spicer and our new employee. New hires, you're welcome to be dismissed if you like, or you can stay. Next, we're going to have Department Spotlight. Ms. Meeburn.
Is she here?
Yeah, she's right there.
Good afternoon. Today we have some community partners that helped us during the Christmas holidays and some that are helping us year-round. So I'm going to start with Miss Kaylee. She was with me. She didn't know she needed to sign the paper. But she is from the State Employees Credit Union on 33. Next we have Miss Pam from Peace Presbyterian Church. And lastly, we have Chief Crandall and Chief May from the Department of Adult Corrections, Probation, and Parole Officers. So I'll start with Miss Kaylee. Miss Kaylee and the Credit Union did what we call a general toy drive. Because they did a general toy drive, we were able to provide toys to all our functions, assessments, in-home, and foster care. Peace Presbyterian Church sponsored several specific children and families for Christmas. And the chief probation officers, their office sponsored specific families as well. Thank you doesn't begin to cover how grateful we are for you guys opening your hearts and your arms to us. Thank you is the least that we can say to show you our appreciation for everything you did for us and the families that we serve. We look forward to working with you, and we thank you, thank you, thank you. And if you guys don't mind, I want them to stand right there so she can get a picture, if that's okay?
Absolutely. Of course it is. I think our director and our board chair should be on each side. Great partners.
Wheel of Fortune.
Thank you guys. Next, we have items to report. Brian Avery.
Good afternoon. In your board abstract on page 7 is the report for the Low Income Energy Assistance Program. As of February 29th, 2024, we had assisted families with heating assistance in the amount of $1,122,000. $452,648 was remaining at that point. We have assisted 3,044 households in Pitt County with heating assistance as of February 29th, 2024. I would like to mention that Thursday, March 28th, will be the final day to apply for the Low Income Energy Assistance Program. We received confirmation yesterday from Health and Human Services that that is the last day to apply. Normally, the program runs through March 31st, but the 29th is a Good Friday holiday, and then the 30th and the 31st are on the weekend. So there will be no online application availability or in-person application availability after Thursday, March 28th.
Brian, could you just let folks know with this amount of funding and the number of families that we're able to serve, where does the Department of Social Services receive this money from?
This is all federal money which is passed through the Department of Health and Human Services, the Heating Assistance Program.
Thank you.
Is it out? Is it all spent?
We still have funds available. And but after March 28th, there'll be no more applications received for that program. On page 8 of your abstract is the Medicaid processing report for February. Pitt County DSS did not pass the report card for the month of February. Our disability applications for Medicaid, we were 85% timeliness, and 90% is required. All other categories, we were at 57% and 90% required. And at last month's meeting, I spoke about a lot of this is due to our vacancies, our staffing issues, the volumes of applications that have been received. The state has granted a blanket waiver for the month of February for all counties which did not pass the February report card. And we received this after you received the board packet. So I'll just read what was part of that decision to sort of explain why a blanket waiver was given. On December 1st, 2023, North Carolina expanded Medicaid, and many individuals that were once not eligible for Medicaid are now eligible. The application volume has doubled for counties. Due to the increased application volume from expansion and open enrollment, along with online verification system and Employment Security Commission system issues, there was a significant impact on the local DSS agency's ability to process Medicaid applications timely. Due to these issues, the county is not able to process February applications in a timely manner. Division of Health Benefits has determined that this waiver for the month of February 2024 is warranted. Counties do not need to submit any waiver requests. So that was granted statewide because of the issues in February. Counties are allowed to submit waivers individually when there are issues which affect processing. And we did submit a waiver for the previous month's failure in January, and we're still waiting to hear from that. But I just wanted you to be aware that all counties that did not pass in February were granted a waiver.
Brian, could you just explain a little bit about, so when Medicaid expansion was being talked about and plans were being made on how to implement extra help for counties, they were going through a process where some of these applications could go straight through and counties wouldn't even have to touch those. And if you could just give us a little bit of an update. I'm not sure it's working the way it was planned.
Well, some were converted electronically. They were people who were already receiving a lesser benefit Medicaid program and could be converted. So with Pitt County had probably, well, it exceeded 5,000 individuals who were converted electronically. But what Ms. Rochelle is more specifically referring to is straight through processing. And some applications that are made online can be straight through processing can happen. So if you look on the Medicaid report card, during the month of February, 41 applications were processed by straight through processing. 36 were approved, 5 were denied. That's a very small percentage of the applications that are having to be processed. Those are reflected on the report card, but everything you see on page 9, which is in your abstract, which is the monthly report that I'm showing, the number of individuals that are applying and what is being processed, that figure is what we are actually processing in-house. So for the month of February, we received 991 individuals who applied, and we processed 1,339. So looking at this report, although it is slow progress, the number being received is declining and the number being processed is increasing. That's the trend we're seeing right now. And it's not fast. So for the month of February, because of the process of getting our positions filled, getting staff in place, we're not going to pass right now. But the trend is that we are making progress in that area by looking at these figures. I can share with you that what we're doing with filling our positions since the last board meeting, we have completed interviews in the area of Medicaid and filled 8 positions that are strictly Medicaid. There are still 6 Medicaid expansion positions which are vacant. They had to be reposted. Earlier in the month, we received those applications back. But I did want you to know that there were some other Medicaid vacancies, people that are going to be coming in to fill those positions, and there were 8. Totally of all of our vacancies, and a shout out to our supervisors, program managers who have been involved in this process. We have completed the process. Recommendations have been made. Start dates have been agreed upon, and we will have 17. We have 17 positions that we filled over the last 5 weeks. So that was a great accomplishment. Of those 17, we had 13 that are new hires, and hopefully approximately 13 or so, you will meet all those individuals at your April meeting. We'll be happy about that. We're happy that they're joining us. They will be coming in over the next 2 to 3 to 4 weeks. We still have approximately 17 vacancies remaining, and 6 of the Medicaid expansion are part of that. So we've been working very diligently to fill the positions, and I'm happy about the progress we've made, and we look forward to next month when you can meet all the folks that are going to be coming in to assist us. And I'm happy to answer any questions you may have.
Mr. Chair, I have a question.
Sure.
Brian, so under the pending column, so those are just carryovers for the previous month that have not been processed?
They are applications that were pending as of March 1st. And this represents individuals, so you could have an application with 3 family members on it, but this represents the total number of individuals that applied. You could have a single applicant, or you could have 5 in a household. Okay. So yes, as of March 1st, that's how many were still pending.
Gotcha.
That's correct.
We have any other questions for Brian? Thanks, Brian.
Thank you.
Next, we have the director's report.
So, I'll go through my directors, but the point that I wanted to make, as far as the Medicaid goes, is the straight-through process that Brian had referred to, that was approximately 100 of those new applications went straight through. But when this was first talked about, at least it appeared for me, and feel free to correct me, the number of applications that would have gone straight through would have been many more than what's happening. And so the bulk of these new applications are falling back on the counties, and I guess that's the takeaway that I wanted you all to have. So the help that was supposed to be there and ready for us isn't showing up the way that we need to. So in addition to the vacancies, we're also taking it, with our folks that we do have. So, and nobody wants to hold back on getting someone approved for their Medicaid because it's so important to them, but you can only do so much. So anyway, I commend both the Medicaid and our food and nutrition services for the applications that have poured in there and that they've been able to get through to the best of their ability. When I say the work is a miracle, it truly is, that they're able to do what they can do. So anyway, so our next meeting date is April 9th. Most of that meeting will be me going over our budget for the next year, and there'll be lots of statistics and data to show you where we're at, why we're needing more positions to be able to do the work and the casework. There'll be information on there as far as the amount of money that Pitt County Department of Social Services brings into Pitt County compared to the amount of local share that's paid out in services. So I think it'll be enlightening for most folks. And what I will do for the board and Tanya Cannon, who's also our business officer, will make sure that you have a written copy of the budget, because you'll need to pass it as a DSS board as well. But the presentation that I'll do will be pretty close to what we're going to be doing to the Board of County Commissioners. So be ready for that, lots of numbers. I just want to recognize that March is Social Worker Month. We will be getting a proclamation from the Board of County Commissioners at their March 18th meeting at 6 p.m. And we're also going to be planting a tree and have some activities for the social workers just to acknowledge them and all the hard work that they do. I will be speaking at the Care for 4 Carolina Medication Expansion event. This is a group of folks that spent a great deal of time trying to get Medicaid expansion through. So this is kind of one of their last events. They're going around to different counties to talk about what they've done, to recognize the fact that Medicaid expansion has gone through, and we will have some income maintenance people there to be able to take applications if anybody shows up. And there'll be a lunch, and there'll be other folks speaking besides me, but I'll be one of the speakers there, and I don't have a list of everybody, but it'll be mostly people that care for Carolina. There is a joint board meeting April 18th through to the 19th with all of our North Carolina departments of Department of Social Services boards. And Jan, if you can, is that in Raleigh or?
I think Greensboro.
Greensboro, okay. And at the end of March, I have booked off my week, and my plan is, since that is spring break, I want to be able to go out with my social workers to conduct as many home visits as possible so that I can meet my foster children, see how they're doing so that they know who I am, and possibly be able to go out to some of the facilities as well. So, and that's something I'd like to do more often, and just so that they know who I am, and I feel like they are my children, so, they better know who their guardian is, and just to see how they're getting along. So that's that's the end of my director's report. Thank you.
Do you have any questions for the director?
No, but I do like to take this time to make my comments.
Board member comments are next.
I'm very concerned about the security that been brought to us today. And I would like to say to the director and the entire administrative staff of this division to examine the physical aspects of the facilities in which they work. I'd like to see a report on the problems that I heard today. I would like to also like to receive a recommendation on the steps that need to be taken so that everyone who works in Pitt County can feel as safe as I do when I come to a board meeting. I do not think that is an impossible task, because I will be following it up. And they are right. We are in a culture that we have to be making sure that our staff, our visitors, and everyone who visit the facility in which we work are safe. I must say that I'm not that one who would entertain voting for staff to carry weapons for guns, because it is very hard in a service like this that law enforcement can tell the difference between staff and visitors or potentials. So I would like for every administrator, do not put the burden on our director. I like for each administrator to make their own assessment and pass it to the director, as it should be, so that she would take the appropriate the appropriate steps to take it where it needs to go. I'm very concerned about health, welfare, and security. So I'm making this strong statement because that's just exactly how I feel. as a board member to this board and as a board member elected to the Pitt County Board of Commissioners by the people who will have the power to elect me. I feel like I've not done the best job. When staff has to bring, and I don't know if they were administrators though, so I can't say that, but when staff have to bring it to us, and administrators did not pass it up the line so that we can get it, because this is what we should be about, making sure that our communities are safe as well as our staff. Thank you.
Thank you. Any other board member comments?
Yes. First of all, I do want to say Happy Social Work Month to all of my fellow social workers. The job you do is not an easy one, and I am incredibly grateful for it and glad to be part of you. I also want to say Ramadan Mubarak to anyone who might be beginning the first days of Ramadan right now, and wish all of our staff and those who participate in our services an easy fast for the month. I also want to talk about the safety of the building. We as a board don't have the ability to make all of the changes that have been requested, and there were some very good suggestions. However, I want to know, Sharon, how we can support you as you advocate for your staff to be as safe as possible. I also want you to know that this does not all fall on you. You share this building with many different entities. Bullets don't have names and they don't have positions. So if someone makes a threat to someone in Pitt County Social Services, who's to say they're not in the elevator with someone from Pitt County Schools or Emergency Management? This is a collaborative effort. And however we can support you, however I can support you in creating collaboration between the various entities to come up with a safety plan, because it doesn't seem there is one for the entire building. There may not be one for each department, but there doesn't seem to be one for the entire building. And however we can support you in that collaboration, please know that, at least from me, you have it.
Thank you.
I would like to say definitely what Colleen, I want to agree. I agree wholeheartedly with that. It's disturbing that in a society where we're seeing this every day on television and social media, terrible things are happening across our country, and I think we need to step up and keep everyone safe. And it seems like some of these recommendations made by staff were fairly doable. So thank you for them feeling, having the courage to reach out to us, and also thank you for all y'all do, the social workers in Pitt County, and our two here on the board. So thank you.
All right. I'll just say, it's pretty powerful things said today, and I applaud the staff for coming and speaking up. Sharon, I'm confident that you will take things serious and give the board some feedback, and we're here to support you.
And I just wanted to mention that I did talk with County Manager Gallagher, and we are looking in, at this point, 2 different agencies that could provide security in both of our buildings. That doesn't necessarily mean that there'll be somebody for the annex building, which I just want to point out. There's 3 or 4 buildings behind the Human Services Center that are pretty much out there on their own. And I think when Alva spoke today, you literally, I think there's a buzzer on the door, but once you walk in, you're in an open area. And unfortunately, that's where our child support and daycare offices are. So, but I think with everything that's been brought forward and some of the issues that staff have faced over there, that the security officer is step in the right direction.
Thank you.
My comments is not to mean that I feel that you're inadequate.
Oh, I know that.
I just want the public to know that. But and as I said before, it is not your responsibility alone. It's all of our responsibilities. And if I sound pretty strong, I am strong about that. But your administrators should have brought that, pointed out. This building is the only one I know that's really as secured as it is. I can't walk down the hall when I come in the front door. And I'm not saying that's a bad thing, but I think in administration, when you have administrative duties, it does not stop at the door. Thank you, Sharon, for all you do. And I'm glad to see that smile on your face, because that's what I look for. Mr. Chair, if I'm in order, I'll offer a motion that we adjourn.
A second.
Second. All in favor?
Aye.
All opposed? We adjourn.